All right, thank you guys for coming. Good morning and welcome. Happy Monday, everyone. I hope everyone had a great weekend. I'm Allison Wilson, Director of the Office of Communications for Prince George's County Executive Angela Also-Brooks, and we are here at Adventist Healthcare Fort Washington Medical Center today to celebrate Prince George's County's success securing critical funding during the 2024 legislative session and what that funding means to advancing strategic priorities in the county and improving the lives of Prince Georgians, particularly around healthcare expansion. And so today you're going to hear from County Executive Also-Brooks, followed by Delegate Chris Valderrama, followed by County Council Vice Chair Sidney Harrison, and then the Adventist team, Adventist Healthcare CEO Terry Ford, and Fort Washington Medical Center President Unmi Shim. We also just want to give acknowledgement and special thanks to Delegate Jamila Woods and Obie Patterson, who has served this area for many, many years, both as a senator and a councilman. So thank you all for coming and enduring the sun a bit with us. And without further ado, County Executive.
Good morning, everyone. It really is. What an exciting day for us to have a chance to come here and to celebrate what really is such an important step forward in ensuring that we close up many of the inequities we've seen in healthcare access in our county. And this is a day where we're able to really celebrate that. I want to thank my partners who are here. There are so many from our community leaders to my friends in elective service. I also want to acknowledge in his absence Senator Anthony Muse, who was also a really important part of this team and were able to help us really to deliver. Now, what we know is that we have come to the end of yet another successful legislative session. I tell you quite truthfully, this is one of the baddest delegations in the state of Maryland. I think I say that without exaggeration. They have brought back historic amounts of funding to Prince George's County, and they have done so in so many consecutive sessions that I think the only conclusion we can reach is that this particular legislative team is really, really, really good. That they are just have been so focused and so strategic in their efforts, and that it just cannot be by accident that they continue one session after the next, bringing back historic levels of state funding to Prince George's County. And I think it's hard also to overstate the context that this legislative session took place in. We all went into 2024 and everyone was aware of it, and this legislative session facing some pretty stiff headwinds. We know that this is a very tough economic climate for counties across the state and for the state itself. And the state budget is a tight one. And so when we laid out our priorities before the start of the session, we know that conditions threatened to dampen our expectations of what we could achieve since our lawmakers, and we knew that the lawmakers and governor would have to make really hard decisions. Let me go back also and say thank you to our Deputy Chief Administrative Officer, Dr. Sanmi Ariola, who is here this morning, who has also done a really amazing job for our county. I want to thank him for his leadership and for his presence. Now, what we did is that we set goals together. And we had these incredible partners who didn't wait for our legislative session to start, but we have now developed the habit of coming together several months in advance of our legislative session and laying out together the priorities for our county and deciding how we were going to move together as a team. And we've been fortunate to be able to do amazing work because of that. Now, this team advocated for us because what we were asking for, and we should be so clear about this, were not luxuries for our county, but these truly are necessities. And they made the case that we know to be true, and that is that our priorities here in Prince George's County are in fact in line with the state's priorities. So I want to acknowledge all of our partners who are here this morning. Many of them have been acknowledged, but they're worth acknowledging. Again, the chair of our Senate delegation who wanted to be here this morning, but had a conflict and could not be present, Senator Michael Jackson. Of course, again, recognizing Senator Anthony Muse. I also want to recognize, again, Delegate Chris Valderrama, as well as Delegate Jamila Woods, as well as, again, the Vice Chair of our County Council, Sidney Harrison, whose district we are in, and also want to acknowledge the remaining members of our state District 26 who are also, we're in their district this morning. Now, all of you, along with our entire delegation and council, have been great partners that played a tremendous role in our success. I also want to acknowledge Governor Wes Moore and Lieutenant Governor Aruna Miller, who have been great partners with us since day one of their administration, and they helped to deliver for us again this year by including funding for some of our key priorities in their FY25 budget. And think about this. We had capital asks. For those who wonder whether we're speaking by way of exaggeration this morning, we had capital asks going into this session of $211 million. And I want you to know that even in this very, very difficult and challenging budget year that we had, and through the work of this delegation, we were able to secure over $198 million for our priority projects. In a year that everyone said the odds were insurmountable because of our budget challenges, we came together as Team Prince George's and we delivered for Prince Georgians. Now, we not only left this legislative session extremely successful, but we came back successful in a way that also builds on a foundation laid by previous sessions. We achieved a set of legislative wins that protect our community from climate change, as well as expand opportunities for small businesses. We received funding, for example, to continue our redevelopment of the formerly Cheverly Hospital site. Many of you know this is the highest point in our county. It is a really important piece of our puzzle here in the county, an economic puzzle. And we received more capital to support also our key economic investment, the Blue Line Corridor. The Cheverly Hospital site, we were able to complete what was needed of the roughly $19 million to demolish that site so that we can now infuse it. There will be $1 billion investment going in that place, which is going to be really important. We also saw the appropriation of $100 million for the future site of our FBI headquarters. And I hope y'all are super excited about that FBI headquarters that I can tell you without exaggeration will quite literally change the economy in Prince George's County. Now, these significant achievements improve the quality of life for our residents and create tremendous economic opportunity across our state. Our major priority going into this session was health care access. And our county's most recent health care needs assessment reveals some really sobering news. Prince George's County has vast gaps in health care infrastructure. Our county is short over 1,000 physicians, and half of that gap is for primary care physicians. We have a 475 hospital bed deficit, even after historic efforts to expand bed capacity over the last decade. We also have the second highest birth rate in the state, yet nearly 80% of residents giving birth have to leave Prince George's County in order to do so. Within our county, we know that Inner Beltway and South County have 2 to 15 times lower concentration of physicians than other communities. Let me say that again. Did you know in South County and in our Inner Beltway, we have 2 to 15 times lower concentration of physicians than other communities. These gaps have real consequences for our county, especially since our study also shows that Prince Georgians have higher social needs than the average American or state of Maryland resident. And as a result of these gaps, residents seek over 40% of their health care needs outside of Prince George's County. Those were the stakes that we were facing when we entered this tough legislative session. So we had to invest in creating better outcomes for our residents. We had to win for our residents and for the future of our county. And I'm so proud to say that that's exactly what we did, bringing home $38.8 million to invest in critical health care infrastructure. Of that $38 million, $19 million went for the Luminous Healthcare Women's Health Tower. This new OBGYN wing will have surgical capacities, maternal inpatient beds, and women's and children's services. And this important funding will benefit women across Maryland by increasing our capacity to provide care. And again, just to put another point there, 80% of our families have to leave our county to deliver their babies. And one of the really scary things that I heard from physicians is, would you believe that they said that many of our women who come to deliver babies have only had one prenatal appointment when they get there. This is amazing. This is horrible. And so we also have successfully allocated $1.4 million to modernize the Luminous Health Emergency Department. This funding will help Luminous provide more advanced care in the ER, leading also to better patient outcomes. Delegate Kim Taylor, thank you also for being here. She's joined us. Want to acknowledge her. We received $1 million. Yes, give her a round of applause. We received $1 million for the MedStar Southern Maryland ICU bed expansion. This funding will help construct a 30-bed advanced critical care tower with an additional floor that will include shell space. This provides us the option to offer future private medical surgical beds to patients, which will help promote healing and improve our bed capacity county and statewide. We brought home $2.5 million for the Capital Region Ella Medical Office Building, and this funding will be used to improve, expand, and renovate the 125,000 square foot facility to improve primary and urgent care inside the Beltway. We secured $1.5 million for the CCI Health Services expansion, which will go to site improvement and capital equipping of the current facility, and received $2.9 million for the Greater Baden Medical Clinic, which will help us expand primary care. And we're here to celebrate this morning the Adventist Healthcare's Fort Washington Medical Center, because we were able to secure $10 million toward construction of a brand new Adventist healthcare facility right here in South County. Now, we're going to need, I don't want anyone to get too relaxed, because we're going to need many more dollars than that, and we want you to know this is an important first step, the $10 million investment, but we are going to send this super bad team back, and we're going to fight until we get every dollar we need to build this facility. Now, I want to thank Fort Washington Medical Center President Umi Shem, who is amazing and who has been on the forefront. We've met so many times regarding this movement forward, and want to thank her so much for her leadership. Also, Adventist Healthcare CEO Terry Ford, want to thank him so much for his advocacy and leadership, because they have been such a valued partner for this county and a trusted provider to our residents. It was during COVID-19 where we met on so many occasions to talk about the needs that were here. And I think it's worth mentioning, so that we never forget what we're talking about, is that the people of South County, in particular Fort Washington, had to endure a time during COVID-19 where we brought tractor trailers into a parking lot because we didn't have the ICU capacity to care for so many who were sick down here during COVID-19. That's what we're talking about. So this funding is a big win, not only because of what they've done for this county, but because they are perfectly situated, what they're perfectly situated to do in the future, which is to help bring health equity to South County. Residents in South County are struggling with elevated rates of food insecurity, issues with housing quality and transportation quality. And what makes matters worse is that South County is also considered to be a healthcare desert. Residents here experience the third largest physician and bed gaps in the county and have to leave home in higher rates to seek cardiovascular, obstetrics, and pulmonary services. That's why this new hospital will be an absolute game changer. It directly meets the needs of South County, and just as a strong Prince George's County benefits the entire state, when we address the needs of South County, we strengthen the entire county and region. So these are the kinds of targeted investments. Thank you, yes. that will reverse the disparities that exist both here and across the county as a whole. Prince Georgians should not have to leave the comfort of their own county in search of quality health care. Having convenient access to care right here at home makes it easier to get regular checkups, screenings, and preventive care. Now residents can address health issues early before they grow into more serious problems. So securing this funding was a big win. But understand that we are not done. We will continue to invest resources into South County because access to quality health care will continue to be our priority. We'll be a healthier county for it, and will reduce health care costs in the long run. So again, I want to thank Adventist Healthcare for partnering with us on this priority. I want to thank our delegation. I want to thank Governor Moore. They understand that our priorities align with the state's own, and they worked hard through a challenging legislative session to get Prince Georgians the resources that we need. Because of our great teamwork, we were able to make progress on life-changing projects that will pay off for all of us in the long run. So thank you so much. I'm going to hand the program back to Delegate. I'm going to hand it to Allison, and she'll tell us the order of the program so I don't mess it up. Thank you.
Delegate Valderrama. And it was one of them. And you'll introduce City Years. I'm sorry, after you City Years. Oh, okay, great. Okay. Good afternoon. Good afternoon, Adventist Healthcare. Oh my. Okay, good afternoon, Adventist Healthcare. That's better. For those of you who may not know me, my name is Chris Valderrama. I'm one of the several legislators that here represent and honorably represent District 26. It's an honor for me to be here with you this afternoon. I would be remiss if I did not mention, I want to send regrets, I'm sure she has done so already, but the chairwoman of our Prince George's County House delegation, Nicole Williams, who was to be here and had asked me to represent as the senior delegate of District 26, I was happy to do so. And of course, it's my district, me and Delegate Woods' district. So having said that, I'm sorry. I wanted to also say, can we please give an extra round of applause for our county exec, Angela Alsobrooks, doing an amazing job. She had mentioned something that I was going to touch on, but I'll touch on it anyway, because Adventist Health, well, it wasn't Adventist Healthcare. I used to be a regular here at Fort Washington Medical Center, unfortunately. I was not, but my parents were. So to have this institution here and so close to home was very essential, convenient, and I'm sure it wasn't just for me, but for many others here in District 26. So when there was talk about having this hospital removed, at one point, I was adamant. Now, I'm a tiny little thing, but I'm very spicy. And so I made sure I made my voice heard, and this hospital never left. And to see Adventists come and acquire and take care of us here was just such a big blessing to me, and I'm sure many other people here in the county. We say it's here in District 26, but many, many citizens come here from around the county. So it's not just District 26 constituents. So as I said, I used to be a regular here, but I took a tour of this facility in 2020, and that is when I met the famous President Unmi Shim. She is a rock star. Give her a round of applause. County Executive Alsobrooks mentioned the mobile units that were here, but for me, I was so grateful for it, but at the same time disheartened, because why did we have that? Whereas every other institution had actual facilities. With that said, as many of you know, this is, in the heart of District 26, and many of the people here, their medical needs are so sorely underserved, and improved health care is the promise that Adventist Healthcare Fort Washington Medical Center has said that they would provide. And I want to state here clearly that the Prince George's County delegation, I can only speak for the House, but I'm sure the Senate will step in as well. And particularly those of us from District 26, Senator Muse, Delegate Woods, myself, and Delegate Turner. We're here and are committed to building this facility into a first-class hospital. I already think it's a first-class hospital, but compared to many others, I'm sure we can agree that maybe not on the same level. So
as the county exec mentioned, this legislative session, especially when it comes to not just bond bills and fiscal issues, it was a pretty tough one. I was just telling President Shim that I couldn't believe that we had gone in, that we were in Annapolis, and now I can't believe we're done. But thank God. So we can get back to the work of our respective districts. With that said, we were approached, Delegate Woods and I, by President Shim and the administration that we need to get a commitment from the state of $150 million. And even if it is dispersed over a number of years, we need that commitment from the state. So again, here to testify that we will do our best, if not, is there more than best? I'm not sure, to make sure that we get that money so that we can continue here. We were able, as the county exec mentioned, to initially get $5 million, but that was increased to $10 million, which again is a very small fraction of what we need for the totality of $250 million that is needed to come to make fruition this complete facility here in Prince George's County. So for all of us here in District 26, including myself and Delegate Woods, that is our commitment that we will double down and redouble our efforts next session, and God forbid we don't have to do it the next session, but we can get it done next session to get the monies that are needed. Again, I want to emphasize, for those of you here, we may be in the legislature, but we need advocates to also express their voices through us or come up to Annapolis and let those know that this hospital means something to us here in District 26 in the county because it provides for all. So with that said, we are here to commit to get that $150 million from the state in addition to the $250 that you need in totality. So with that said, thank you so much for inviting me here this afternoon. It was my honor to represent here and especially Adventist Healthcare. So thank you very much. With that said, it is my honor to introduce County Councilman Sidney Harrison. I am sweating to death. Okay, I want to.
Good morning. My name is Sidney Harrison, and I just want to first start off to saying thank you to everyone that is here this morning participating in this most important day. I want to thank the county executive. Let me just be clear, over the last 6 years that I've had the chance to witness the leadership of the county executive, she's never blinked, she's never had any real, what I would say, issue with sticking up for Prince George's County when it comes to health care. She's made the investment. I mean, when you think about the ask of capital improvement projects from the state, $211 million, and you were able to work with our state partners, Delegate Valderrama, Delegate Kim Taylor, Delegate Jones, to make sure that we brought that funding back. We need to give our representatives from the state and our county executive a round of applause for delivering $196 million. That is fabulous. As somebody that has had the opportunity not only to tour this hospital, and actually being a patient here as a 9-year-old little boy who had third-degree burns on his ankle, I realize how our community evolves, our hospitals evolve, and when you look at the importance of investing into our healthcare infrastructure, we know that that improves the quality of life for the citizens of Prince George's County. What's interesting about what you were saying, Madam County Executive, was the needs are great here in Prince George's County. The needs are great. While we look at our life expectancy rates, from one point of the county, we have a high life expectancy rate to a 15-minute drive. We have a 2-decade less life expectancy rate. And the county executive, along with our state leaders, knew that we had to do all that we can to invest in our infrastructure. There's silver linings in COVID and what COVID taught us, and how we evolve as a community. And so I want to thank the leadership of Adventist Fort Washington Medical Hospital Systems here for their leadership in advocating to the elected officials to make sure that we do all we can to invest into people. Each and every day, you are stepping in the front lines to save lives, to improve quality of life and health care. And we as elected officials, we need to make sure that we're doing all that we can. So, Madam County Executive, I appreciate you being a champion in the healthcare landscape, and I will fight with you and for you to make sure that we do all that we can on the county council level. I know that the delegates and the senators will fight for us as well in the next budget session. This is just the start. And Madam Chair Jolene Ivey, she could not be here today, but she wanted to make sure that we were able to vocalize that our commitment is in the healthcare landscape as we serve as the Board of Health. And we'll do all that we can to make sure that we're making that investment. Thank you for the opportunity to speak, and look forward to continued work.
Thank you, sir. And that was a perfect segue. You'll now hear from Adventist Healthcare CEO Terry Ford, followed by Fort Washington Hospital President Unmi Shim.
Greetings, everyone. It's just really good to be with you today. I want to share another voice that needs to be heard today, and that's the voice of our patients, their family members, the volunteers, the physicians, the nurses, the dietary folks that take care of this hospital, everybody that's involved with healthcare, not just here at Fort Washington, but throughout the county. Thank you, County Executive, to you and your team, to our delegation, to our county council members. Your recognition of healthcare as being important is so valuable. This county deserves to be focused on in a way that we haven't seen in several decades. And you've listened, you came, you toured this site, you were willing to look through all the data that we shared with you. And it's true, the facts point out that we can provide better health care here in Prince George's County. Now, we're at Fort Washington Medical Center site, but this is true throughout the county, in a county that's growing in population and a diversity of healthcare needs. I want to thank Unmi Shim, the president of Fort Washington. She has been unwavering in the focus of this project at Fort Washington, and we believe that with the leadership that she brings and her team, we can solve this together. This is a first step of a comprehensive plan, and it's an important comprehensive plan to get right. You can count on Adventist Healthcare to walk with you and be with you every step of the way as we continue to address it. A hospital like this brings physicians. Physicians need a place that they can work with the technology, the location, the services at a hospital. You can't have one without the other. And I think a comprehensive approach that brings physicians to this area, along with added beds, the technology, and the places that patients can get great care, will be a wonderful legacy for Southern Prince George's County, as well as the other healthcare hospitals in the state. So, County Executive, a heartfelt thanks to you and your team, and we'll walk with you on that journey. We're not giving up today or in the future. This is too important to focus on. Thank you.
Good afternoon. Well, we are sitting here. We are now in the afternoon. I just want to say welcome to everybody who attended this media briefing. There are a lot of good stories to share here at Fort Washington Medical Center. There are a lot of challenging stories to share here at Fort Washington Medical Center. We wish the environment that we care for our patients would be a little bit different than what we currently offer. All of the hospital space is about 62,000 square feet. As a matter of fact, we're going to need about 5 or 6 times bigger facility to appropriately take care of the community, even if we are to take care of same number of patients. But we know we are not serving the needs of the community the best we can or to the fullest we can because of the limitations this facility offers. We're very grateful for the Governor Moore donating the modular unit, 16-bed ICU unit. It came in at the right time, very handy for us, but it's still a temporary structure. What we need is a bigger hospital that is really fitting the needs of this community's growing healthcare service needs. So Adventist Healthcare is committed to making that happen. And we came into Fort Washington Medical Center back in 2019 at the end of October. And you all know what happened at the beginning of 2020, right? Pandemic came, and I never forget the time when I got a phone call from the state representative saying that we looked at all the hospitals, 47 acute care hospitals of the state, and we found that your hospital may be at risk the most for the surge capacity based on number of emergency room visits you had historically. You're going to need a lot more beds. And sure enough, that turned out to be the case. At one point during the pandemic, over 70% of our patients were COVID positive. This area suffered a lot of issues because of the pandemic. And we are at the forefront of it with a very limited capacity to take care of them. That's when they said, we know you have 37 beds, but we're going to give you 46 additional beds. Just think about that. This community, as it was back then, as it is now, can use 37 beds plus 53 beds right then and there, right? So the need for new and bigger capacity is great, and we know that, and we're very excited and thankful to the county executive for advocating for us. I never forget almost hijacking Dr. Ariola when he arrived. I was so anxious to get to the meeting with him to let him know what's going on in our community, and working together with him, we were able to come up with a plan to propose, and our county executive said this has to be done. So we're very grateful for everything the county leadership has done. County council had called us to testify at the Board of Health meeting about emergency room wait time. And we know it's a function of capacity limitation that we have long wait time in this county, not because our team is not working hard or working well for that matter. It's because of the capacity limitation that we have long ED wait time. So as we journey through growing the hospital, adding services, bringing more providers to serve the community, and advocating for this new hospital, we had the county behind us every step of the way, and we feel very grateful and privileged because of that. And I just want to say thank you to the county executive leadership team, county council members for really helping us every step of the way. We also want to say thank you to our delegation. I know that I invite them from time to time to say, here's what's going on at the hospital. We need this help or that help. They always come through. So the Delegate Balderrama, Delegate Woods, Delegate Veronica, all of them have been very, very helpful, along with our Senator Tony Muse. But I also want to call out somebody very special to Fort Washington Medical Center. That's our past Senator, Obie Patterson. Obie, when I got here, told me, Uni, what you need? I told him, we need new MRI, new CT scanner. He said, okay, let me see what I can do. Since then, he's been getting funding after, I think, totaling almost $10 million over the years. So I just want to say thank you, Obie, for your support of this hospital. And I said, I got to tour him with a new CT scanner that went into operation about 2 weeks ago. There's a lot could be said, a lot could be desired, but one thing I do want to say is I believe Adventist Healthcare knows how to deliver healthcare, right, Terry? We do a good job. We have the first A-grade, Leaf Rock A-grade hospital in Montgomery County, And I can tell you we're not that far behind. In the next couple weeks, we want to be able to share great news. We're embargoed, so I can't really tell you that, but without spilling the bean, I can tell you that Adventist Healthcare Fort Washington Medical Center knows how to take care of our patients. And we have great team members here. We have great providers here. They work hard. They're very committed to this hospital. You know why? Because they are from this community. They live in this community. They are part of this community. We are neighbors taking care of neighbors, friends taking care of friends. And so here, our physicians and our staff are doing their level best to take care of our patients the best way they can. So I owe a lot of these things to our team members who are working hard every day to create difference and move things forward. I also believe this new hospital project is going to be not just a hospital project, but transformative project for the community. I believe it will signal and bring in the changes to the area that we have not seen. One, it will increase employment opportunities for the community. We will also work together with the community to create more education opportunities for healthcare so that more of our community residents can become healthcare workforce to take care of each other, right? And it will also bring economic development to the area at a scale that we probably are not thinking of or imagining at this point. So this is truly a transformative opportunity for Fort Washington or the south region of the county, and we're very excited for that. And to partner with all of you is our privilege, and thank you for being here today.